As all of you know, we are seeing more imported cases in China, outside of China, in other countries, including in Singapore. But within Singapore itself, there is no change in our overall status that, as of now, there is no evidence of community spread in Singapore. So there is no change to that. And increasingly, it is becoming also clearer that this virus is different from SARS. As we have said before, it looks like it is more transmissible but less lethal than SARS. But because the virus is more transmissible, because it's spreading to other countries, we are seeing panic buying of items like surgical masks. Some countries like Taiwan have even banned exports of masks, and we have to be prepared that others, more countries may do so. And this will make it difficult for our retailers to access supplies of masks. And over the last 9 days, the government released more than 5 million surgical masks from our stockpile to retailers. The retailers have been controlling the point of sale, right? They have controlled every customer one box. But the masks were snapped up in hours, and you still hear people saying that when I need the masks, I'm unable to access them. So we have deliberated and decided we do have to change our method of distribution. And we will do two things. First, we will prioritize the stockpile of masks that we have for essential services, specifically for our healthcare workers at the front line. I think they need to be protected. They are at the front line, and we have to prioritize the masks for them. Secondly, for the general public, we will do a one-time exercise to release masks from our national stockpile directly to Singaporeans. So we will prepare packets of 4 masks to be distributed to every local household in Singapore. And we will set up distribution points where people can collect these masks from, and Minister Chan later will elaborate on this particular plan. We are doing this to assure Singaporeans that every family will have access to masks if someone in your family really needs it. Meaning to say, if someone in your family falls sick and needs to go out to see a doctor, then you will have the mask at hand for that contingency. So when you get the mask, once the distribution is set up and you are able to collect the mask, please, we would like to call on Singaporeans, please use them responsibly. Do not open up the packet and start using them right away. There is no need to. As far as the medical experts have said, there is no need to. Use it only if you are unwell and have to go out to see the doctor. That is the reason for the mask, and this is the reason why we are doing this one-time exercise to distribute it to Singapore households and to assure people that if you really need to, the mask is available for you. And remember, at the end of the day, masks do not confer automatic protection against the virus. It is not something that you can wear and automatically get protected. In fact, medical experts, not just in Singapore, but in other countries, have highlighted that sometimes wearing the mask or wearing it wrongly can give you a false sense of security. So you wear it, you have a false sense of security. You wear it wrongly, it may not be effective. Worse, if you wear it and then you still use your hands to touch your face constantly, it doesn't help at all, because there is more likelihood that the virus can spread through contact through your hands. Together, we can overcome this situation.